for staying with us here on the AM show. Now, let's talk stroke. It's World Stroke Day today. I have guests in the studio. There's a guest joining us via Zoom. The prevalence of the disease is increasing, and it's the second leading cause of death globally. Very important that we talk about it. And when we introduced our show today, I said somebody close to you somehow may have gotten stroke sometime. And we all shared our various stories. So it's very common. You find it very close to you. But what can you do if somebody that you love suddenly goes down with stroke? My guest in the studio, Dr. Benjamin Sarkodie, is a vascular specialist and interventional radiology with the University of Ghana Medical School. And Dr. Augustina Charway-Felli is president-elect of the African Academy of Neurology, consultant neurologist at the 37 Military Hospital, the Leicester Hospital and Fertility Center, and Eurocore Advanced Diagnostics and Health Center. I hope I said everything right.
Good morning.
Thank you so much for being here. And then joining us via Zoom will be Dr. Albert AKPALU. Oh, there you are, sir. He's a senior lecturer, School of Medicine and Dentistry, College of Health Sciences, University of Ghana. Good morning to you, sir. Thank you so much for your time this morning.
Good morning.
Great. So I want to ask...
Stroke Day.
Sure. I want to ask what stroke is, but first of all, I want you to correct me if I'm wrong. This used to be like an adult kind of disease, correct? We used to see older persons suffer stroke. Is it the same story today?
So it's still a disease that the majority of individuals who get stroke are adults. However, there is stroke that can happen in children, in young adults. But the majority of patients will be the older adult, the elderly adult.
Okay. Dr. AKPALU, can you explain what stroke is, first of all?
Yes, thank you very much. So as Dr. Charway said, stroke affects across the ages, but stroke really is a neurological condition, an acute neurological condition, which is evident by lots of things. Weakness, everybody knows stroke, your face twists, your hand becomes weak, but it can affect any part of your body, your eyes, your motor system, your spinal cord, your vision, your memory, your balance. So all these are acute events, but you have to have objective evidence of an injury to the brain or an infarction or hemorrhage to the brain by a CT scan. So the new definition of stroke means that you have all these symptoms that we know or signs that we know, but you need objective evidence of a CT scan. So we use the term time is brain. When you see these things, we have an acronym called FAST. When you see these things, your face is twisted to one side, you can't move your arm, your speech becomes slurred, or I begin to speak and my speech starts going, they know that something is happening and the team is time, go to somewhere where you can have urgent help. So in a nutshell, that's what stroke is. Stroke affects across the ages. Unfortunately, we are seeing it a lot of young people. So, and it affects 1 in 4 adults worldwide.
Okay.
So the theme for this is do not be the one. So do not be that 1 in 4.
Okay, but Dr. AKPALU, are there always early signs?
No, so we have what we call silent strokes. So these are the most dangerous ones. So silent strokes, you may have some memory loss, you may have some speech loss, some visual side, or you don't have any physical outward signs. So we do a CT scan. So that is the danger. So everybody must know the subtle symptoms and signs of stroke. That's part of the education we are doing. But we must know the symptoms and signs of stroke. And when you see it, you must go immediately. People go through all sorts of channels. I know we are a prayerful nation, but as you are going to pray, go to hospital. As you are going to the herbalist, go to hospital. As you are going to whoever you are going to see, go to the hospital and do whatever you want to do alongside. But you need urgent intervention.
So Dr. Charway and Dr. Sarkodie in the studio, can the damage be reversed somehow? Can you be better again? Maybe you can take it and then she can come in.
Sure. So the good thing is that with increasing knowledge and technology these days, we do have a good window period within which we can reverse and to a large extent limit the damage caused to the brain. There are two main ways of treating this. There's something we call thrombolysis, which means you give a medication to try and melt any clots up in the brain and then open it up so that the blood flow can be restored again. And also you have other methods where people bleed. We mentioned that there are two types of strokes, infarctive and bleeding. So bleeding also, when you know the cause, like there's a brain aneurysm or something that has ruptured, you can fix it. So when you do some of these things, you have a big chance of reversing some of the consequences of the stroke. So for instance, if you present to hospital within 6 hours, there are certain procedures we can do, there are certain medications we can give and be able to reverse it. But the longer the period of before intervention, the more loss of neurons in the brain and the more damage you tend to have.
Okay. So Dr. Charway, anything you want to add? And then yes, I also would want to ask if we can even prevent it. Okay.
So I would unfortunately be the stick in the mud here and be very careful when we use the word reversing the consequences of a stroke. The best way to reverse or reduce the impact of stroke is to prevent it. So yes, there are definitely things that can be done to reduce the likelihood of developing a stroke in anyone. Because even if you are fortunate enough to have thrombolysis or thrombectomy, those are the things that reduce the disability after stroke, there are still subtle things that are left behind. And so that's the whole purpose of the slogan, still don't be the one to get a stroke, even if we can reverse a lot of what happens to you during the stroke. The mainstay of the prevention of stroke, and this is done also after a stroke, is lifestyle changes. So physical activity, taking care of the diseases that underline the stroke. So for example, hypertension, treating the hypertension, making sure your blood pressure is at goal, treating high levels of cholesterol if that is the issue for you. If you are diabetic, making sure your diabetes is under control. But the main cornerstone is lifestyle modification. So you can take all your medications before
okay, and
still after. Yeah. So for all of us, because we are all potential, as long as you have a brain, which is all of us, you are potentially a person who can develop a stroke. So all of us need to do these things to make sure we eat healthily, lots of fruits and vegetables, exercise as much as possible, maintain a healthy weight. A lot of us are deficient in that respect. And if we do develop disease nonetheless, make sure we treat that disease and be at target. So that's going to see your doctor regularly when you're supposed to, taking your medications as prescribed, and understanding that this is a whole lifetime thing. If you develop hypertension, and that is our biggest risk factor for stroke in this country, yeah, if you develop hypertension, there's nothing like a cure for hypertension, but it's definitely manageable. So do take your medications, do exercise like you're recommended, do follow the necessary diets.
Okay. Dr. AKPALU, how long do you have to manage this disease?
I mean, how long or how well?
How long? How long would it take to cautiously saying reversing, but how long typically does it take for you to get better?
So to get better, so we have a time window. So the time window is when you're able to come into hospital. So as Dr. Sarkodie said, if you can come within 6 hours, your chance of us reversing the damage and reducing the disability is very high. But if you do come in, we have a multidisciplinary team. So it's not only doctors who manage stroke. We have physiotherapists, we have nurses, we have occupational therapists, we have speech and language therapists, dietitians, psychologists, priests, and the family. Everybody is involved in managing the stroke. So everybody takes a concerted effort to get you well. So typically, if you come to our stroke unit, within 7 to 10 days, we should get you back home to what we call some functional independence. So if the stroke affects the whole of your right side, and that's what you used to write, it's going to take time. So it takes up to 3 months, 6 months, up to a year to get full recovery in quotes for something that we can reverse. Otherwise, you have to manage with the disability that you have, and that does not make you a different person. But the problems we have is that people are getting second and third stroke. So that is where we have to bring the lifestyle changes, reduce stress. Okay, reduce stress. Ghanaians like stress. We do not like to rest and take breaks. So we need to be happy. Just being happy helps to prevent strokes. And that's work that we've done in Ghana and Nigeria shows that eating green leafy vegetables, physical activity, reducing alcohol intake, we don't have much of a smoking problem. And there's something called atrial fibrillation. I'm sure Dr. Charway, Dr. Sarkodie will talk about, where your heart beats irregularly. We need to catch these things. So these are hidden things. But despite all the things that we do, people still go ahead and have stroke. If you have a family history of stroke, then go and start checking your lipids, your hypertension, and all the other risk factors. So yes, we can manage stroke, but note that if you don't come on time, your blood pressure is not controlled, and you have a very bad, a huge stroke showed by the scan that you have, your mortality is 50%. And of those who survive, another 50% will have another stroke within 3 months, within 6 months, within a year. So the statistics are not too good. So the main thing we can do is to prevent it from happening in the first place. And if it comes, manage the problems we have with the multidisciplinary team that we have.
Great. So Dr. Sarkodie, Dr. Charway, Dr. AKPALU says, reduce the stress and be happy. But that's a period where, because I've had a very close person who got stroke, and all she wanted to do was to die because she couldn't do the normal things. Very active person who suddenly couldn't do anything unless somebody supported her. So that's a very difficult period. So my question is, how do you help yourself, and who can help you? Who do you call?
So as Dr. AKPALU mentioned, it is definitely a multidisciplinary team that assists in the management of someone who's had a stroke. First and foremost, having had a devastating event like a stroke is already by itself a source of despair. Yeah? But that said, having had a stroke by itself, whether or not you acknowledge that it's a devastating event to you, increases your risk for depression. And that's where the multidisciplinary aspect of the team taking care of you when you have a stroke comes in. And definitely we need work with a psychologist. So there are medications that can be given to help manage the depression, but it's also work with the psychologist, talking through things, learning to adapt and cope with the situation that you've been given. So yes, there are some kinds of stresses that we can avoid. Not all stress is avoidable, but it's how you cope with that stress that makes a huge difference. And there the psychologist is very important. Okay,
so Dr. Sarkodie, who do you immediately call?
Well, we have a national ambulance system. There's a number which we will share on the screen. When you start to see some of the symptoms that Dr. AKPALU mentioned, which we have the acronym FAST, you should call one of these numbers to have the ambulance take you to the hospital immediately. In Ghana, a lot of people also rely on private transportation or taxis to the hospital. The point about reporting to hospital very early is key, and we cannot even overemphasize that point. So it's important that once people begin to see changes, like the facial deviation, you begin to feel weakness in one of your arms, you begin to have difficulty speaking and all of that, it is extremely important to start heading to the hospital. It is important that we do not also blame ourselves for some of these conditions. A lot of people who are living in stroke think that they did some bad thing to somebody, they think it's a spiritual attack, and therefore when the symptoms even begin, they don't call the hospital or they don't go to the hospital at the first time. But here we are dealing with time. Time is brain, which means that the longer you stay, the more damage you are doing to yourself. And so it's important that people call the ambulance service or they come to the hospital in their taxis or their private cars as soon as possible, because that is how we can help to reduce the disability associated with the disease.
And Dr. Charway, just to add, if you are alone and you're feeling the signs that Dr. AKPALU talked about, what should you do?
Call somebody, anybody, and say that something is going wrong with me if you can. Or in general, I think our healthcare seeking behaviors in Ghana are a little less than they should be. But it's a good idea to have some kind of plan. Say, for example, you know you have high blood pressure. You can have a stroke without having any of these things, but it's more likely if you have high blood pressure. There should be some kind of plan in place before something happens. So there should be some sort of panic button that we should all have on our phones where you can contact someone that you rely on, and if they realize that something is wrong, they also quickly get help. But it is a very difficult thing. When you're alone, no matter where, if you can't get to the phone, how are you going to call anyone? Yeah, so that's why we have to plan ahead. God forbid something happens, but then there's already a plan in place of how you can get your assistance.
Great. Now, this is a very important subject, and I can relate. There are many others who can also relate. So we're just going to open the phone lines just for a very short time. If you want to talk to the doctors, they're here. You can talk to them and ask what you want to ask. And if you also are confused about something, anything related to the subject, give us a call on 030221169102. Numbers already on your screen, but you have to call us now. So, Dr. AKPALU, I want to ask if we have enough facilities that offer stroke treatment here in our country.
Unfortunately, no. No, we don't. And I think this is a day that we're going to have a press conference at the Ministry of Health from here. And we are praying the ministry, the Ghana Health Service, to help us spread out stroke units across the country. A stroke unit is a place where you can reverse damage. Evidence has shown that being managed in a stroke unit will improve your chances of recovery and will improve your functional independence. Currently, we have only maybe 2-3 functional units in the country. In Accra, so in Accra, Kolebu Teaching Hospital, 37. We've done one at Ridge Hospital and one at La General Hospital, which is being under renovation. Convanoche also has one. We have gone around the country last year training people in teams on how to manage stroke, but we need the facilities. So I'm sorry, but I'm going to be a little apolitical. We have 16 regions, only 4 regions have functional CT scans, and it is not acceptable. The diagnosis of stroke needs a CT scan. There are 2 types of stroke. So as Dr. Sakadi will tell you, if it's an infarct, we give you aspirin. If it's a hemorrhage, we manage it differently. So we need these CT scans across the country, for they are not expensive. So if we are building hospitals, please, Mr. President, add a CT scan to each region. So I'm advocating 1 CT scan per region coming in 2021. That is my only statement I'll make. 1 CT scan per region. It's not acceptable for you to have a stroke in Oti region or Volta region and have to be driven all the way down to Accra or to Togo to go and have a scan. It is not acceptable. So we as stroke professionals are advocating the country, please get us CT scans in each regional capital. The ones that are not working, get them working. And we have the teams on the ground. We have enough physios. We have training occupational therapists. We have stroke nurses. We have doctors who are willing and ready to join this cause. Stroke is the highest cause of morbidity and mortality in terms of cardiovascular diseases for us. Why do we sit and wait and make things worse? So please, JoyNews, please advocate. I want to see it on your screen. 1 CT scan per region.
Okay. So Maoli Jivenu is the one writing, and it shows on the screen. Maoli, make sure you write 1 CT scan, 1 region, please.
Region.
Yeah. We've got Ransford and Ikea joining us. I'll take you first, Ransford. Ransford is in Sawam. Good morning, Ransford.
Yeah, good morning.
Yes, sir. You're on air.
Yes. Please, I wanted to ask the doctor. When I sit on the wall, let me say, I'm sitting on the wall. I feel like strange hardness in one of my legs. I wanted to know, is there symptoms of stroke, or what should I do?
Okay. Okay, all right. Ransford, thank you very much. The doctors will address your question. Let's speak to Ikea. Ikea is in Koforidua.
Hello.
Hello, Ikea. Yes.
Yeah, good morning.
Good morning.
Yeah, my mom has been complaining of heaviness under her feet on one side of her body. I just want to know if it's a sign of stroke.
Okay. All right, Ikea, thank you very much. And then Dominic has just come on. Dominic from Cape Coast. Hello, Dominic.
Yeah, hello, Mama B.
Yes, sir. Thank you for joining us. You're on air.
Okay. Please, I want to find out what are some of the symptoms. Just as the doctor is saying that there's no clear symptoms showing that you get a stroke, but at least there are some things that happens inwardly, like the the blood pressure, and I want to find out at which stage that when you test, when you go for blood, pressure, at least if you have like 120, 80, or 140, 90, or 150, 90, then there is a symptom showing that you might enter into that age. So I want to find out.
Okay. Please. All right. Thank you very much. We'll speak to Richard, and then we'll hold on with a call so we can address the issues that have come up. Richard is in Bolga. Good morning, Richard. Hello, Richard.
Yeah, hello.
Yes, sir. You're on air. Let's hear you.
Okay. I want to find out. I've seen people from God's palsy, and people say it is stroke. So I want to be clear.
Richard,
is God's palsy the same as stroke?
What it is?
Richard, you said you've seen what?
People suffer from God's palsy.
Okay.
So I want to find out what is the difference between stroke and God's palsy.
Okay. All right. Great. Thank you very much. So we had Ransford, Akua, Dominic, and Richard.
Okay, I will try and answer the questions. I will group them because a lot of them, the underlying question is this a stroke or is this not a stroke? So for the first question from Ransford, he gave a very particular situation in which he feels what I understood as numbness in his leg, when he's sitting on a wall. That is not a stroke. But before anyone can say this is a stroke, this is not a stroke, the first thing we need to know is who is the person saying they have this complaint or that complaint. For the individual who was asking about what the signs that you are getting a stroke, that is the problem with stroke. There is no sign that you are getting a stroke. There's a sign that you got a stroke. So there's no warning. The same thing with the blood pressure. There is no blood pressure number that is safe compared to another blood pressure number that is not so safe. Normal blood pressure is 120/80. Anything above that requires either monitoring or taking your medication. And so if you say, oh, my blood pressure is only 140/90, I am safe, you're fooling yourself. Because the thing is, high blood pressure, you don't feel it. You feel it only when it has done something to you. So you can be walking around with 200/110 and not know that you have high blood pressure at all. And that is the problem with our population. Nearly 40% of the adult population in Ghana has high blood pressure. The majority have no idea that they have high blood pressure. And that is why, as you reach adulthood, you're supposed to check your blood pressure on a regular basis, have medicals on a regular basis. So the question about the one-sided deficit, it can be a stroke, but it needs to be seen by a medical professional to determine, yes, it's a stroke. The main thing about stroke, and you can almost be certain that this, I'm having a stroke, is sudden change in the way your body functions. Any sudden change in the way your body functions could be a stroke. And that's why when you suddenly notice that something is not right, not it's gradual, it slowly happens over months, over years, nothing like that. A sudden change in the way your body functions, the way you move, the way you feel things, the way you see, the way you speak, that is possibly a stroke.
Okay.
And that's why we keep saying time. It's sudden and you have no time to waste. Get yourself to a medical facility.
Okay. So now we know, Dr. Sarkodie, that we don't have enough stroke centers. But do we have acute stroke services in Ghana?
Mama V, I think you are treading on another dangerous ground because the stroke centers Dr. AKPALU is already talking about that we don't have. It's like a second-level stroke center. But to have an acute or hyperacute stroke center where you will be able to do certain interventions to reverse the stroke, currently we don't have a single one in the country. Sometimes we know that because government is burdened by a lot of things, malaria, pneumonias, COVID, and other things, it is difficult to put a lot of money in some of these things. And that is why private sector participation is also very important. And Eurocore Advanced Diagnosis Center and Heart Center is venturing into this area of trying to set up a hyperacute stroke center where you come within 4 to 6 hours. And I say that deliberately because within 4 hours, there are certain interventions that can be done. And within 6 hours, there are certain interventions also that can be done. So it's important that within 4 to 6 hours, anybody with stroke who wants to reverse some of these things presents to the hospital. And Dr. AKPALU couldn't have put it right that the CT scan is an essential part of the management of stroke.
Is this CT scan different from the other CT scans you find in the hospital? Is there a special one for stroke?
No, the CT scans are the same, and they do the same thing, looking into the brain when you have a stroke, because the first thing we want to be able to establish is the cause of the stroke. Is this a bleed or is this a clot? Because the management are quite different. And so it's important to establish the type of stroke that this person has, and then you can administer the treatment. So within the onset of your symptoms to the time you report to the hospital, we want it to be as short as possible, so you can even have access to CT scans. And also, if there's a need to do any intervention, we'll be able to do this intervention. Some of the interventions these days, we can put catheters, wires into the brain and extract the clots right within this 6 hours. And right there, you see the patient improving.
And this can be done here in Ghana?
Next month, we are hoping to start this service in Ghana. And of course, like Dr. AKPALU again mentioned, training of paramedical staff, because stroke is not just for doctors. It's not just for the neurologists. We are all partners in this. And so there's the need to train some of the nurses, they need to train the physiotherapists and all of them, so they can come on board and you have a comprehensive approach to treating the patient.
Okay. So Dr. AKPALU, we don't have enough CT scans. How do we manage it? What have we been doing?
We are trying our best, our possible best to limit the numbers. So somebody has a stroke in Upper East, Upper West region. You have to find an ambulance. They come all the way past Tamale down to Kumasi or to Accra to look for a CT scan and then go back. So within that time, you've lost time. So as Dr. Sarkodie and Dr. Charway has said, time is brain. If we can reverse the changes, you can get some function back. So we need to manage blood pressure, keep your sugar under control, and start mobilizing. So the theme for this theme is join the movement. And I'm going to challenge Dr. Charway and Dr. Sarkodie and Mama B yourself to show me some dance moves. So I'm going to start mine. So move. Boxing, all kinds of aerobic activities go. So I've done my movement. So you have to move.
We didn't see that. We didn't see you. We didn't see you.
I'll do the Bukom Banku style.
Move.
Yes.
Move. All right. So we do that and we get our movement going. So I think it's imperative that we all join the fight for stroke. Let us know the symptoms of stroke. As somebody said, Bell's palsy is a weakness of your face. In Ghana, they think you've been slapped by a ghost. And have that type of weakness with stroke as well. So if you see any weakness of your face is twisted to one side, you can't close your eyes, you go to a hospital and a trained professional will help us determine whether it is a Bell's palsy or just a normal facial paralysis or from a stroke. So we need to identify the signs. Let's know the fast. I'm sure you show that before the program ends. Face movement, arm weakness or leg weakness, speech slurred, time, go to hospital. We've added B as well, be fast. B is for balance movement, I is for eyesight, and then the fast follows. So when we see any of these symptoms, please go to hospital. Some of our patients who have hypertension say that they know when their BP is high. There's nothing like that. The brain is ambivariate. You can get a stroke when your BP is low or when your BP is high. So anything across, you need, if you see the signs, please go to hospital.
Okay.
As you're going to hospital, you pray for your libation and anything that you want to do, but please get to hospital because we are getting services to do acute stroke care. You need to get into a stroke unit where a multidisciplinary team of professionals will help.
Okay.
But you can prevent it, as Dr. Charway has said.
Yeah, Dr. Charway wants to add something to what you've been
really
talking about.
quickly. The reason why stroke is such a terrible disease to have is not just because you can die from it. It's not just because you can be paralyzed from it. It's the other little things that we take little notice of but make a big difference. So a stroke affects someone who's usually an adult, who's usually the breadwinner of the family. And the worst thing that the stroke can do to you, and it's less noticeable than the weakness that you can get from a stroke, is cognitive impairment. And that is the loss of ability to reason, to think, to make decisions, etc. And so for fear of all these terrible, terrible things that can happen to you, do the best you can. Every individual has to do the best they can to prevent that first stroke.
Great. So finally, what is Eurocore offering, that people can go there?
So basically, like I mentioned, we don't have any acute stroke center in Ghana as yet. What we are trying to do at Eurocore is to pull a team of specialists together, like Dr. AKPALU, like Dr. Charway, myself, and many other people, to come together to offer an acute stroke service so that we can help people who are suffering from, or who will be suffering from this condition. Unfortunately, the thing with stroke is that beyond prevention for people who have had it already, the only thing you can do is rehabilitation. But we are trying to offer a chance so that we can reverse it altogether when it happens in the acute situation.
Okay.
So this is what we are trying to get as a team. And it's not a one-man show. It's important that we all work together and ensure that we offer some good services to the people of Ghana.
Great. I see we've been putting the number on the screen to Eurocore, so you can contact and then talk to them some more. Can you explain what we're seeing, doctors?
Okay, so this is for public education, how to spot a stroke. Dr. AKPALU has mentioned it several times. We use the acronym, which means an abbreviation FAST, where FAST, F in the FAST stands for face. So if you notice, as they say in Ghana, your face has twisted. Yeah, your face has twisted. Arm is, the A is for arm. One arm is weak. Think about a stroke. If the way you speak suddenly changes, that's the S for speech. The speech, you start to have difficulty with it. The T is for time. We keep saying this. Get yourself to the hospital as quickly as possible. So everyone should remember FAST. Face, arm, speech, time.
Okay.
Something is wrong with your face, your arm, your speech, time, get to the hospital.
Well, doctors, thank you very much for having this very important conversation with us here on our show. Dr. Sarkodie, Dr. Charway, Dr. AKPALU, I'll be our ambassador on the one region, one CT scan.
One CT scan.
Yes. So I'm your ambassador. We should have more conversations on this.
What comes about that? Yes. Thank you very much. And everybody must dance in the studio. Everybody.
Yeah. Please drop some music so we can dance. Thank you, Dr. AKPALU.
Yes.
Thank you. When we come back, we're talking about breast cancer. It's Pink October. We have our final conversation. Not that we're forgetting about the subject, but we're talking about it. We're bringing it all together. Everything that you've missed in the month of October here on our show. Dr. Salah will be with us. Stay with us.